Hello, hello. Hey, Tanya. Thank you for coming. Hey, Ted. Thank you for being here. I'm going to let a few more people come in before we start. There's a lot to cover. And I want to try to get everybody all the questions that I've been getting. So I'll wait for a few more people to come in. Happy Sunday. If y'all haven't got your tea, I told you come join me for some tea. Y'all know I love tea. It's not too cold out here, but it's always a good day for some tea. We'll let a few more people come in. I hope you guys are having as good a weather as I am out here in Atlanta. Hey, Nina. Thank you for coming. Hey, Cheryl. Thank you for coming. I don't want to hold you for long, so we'll get started pretty soon. It's snowing in Detroit. Fortunately, it's not snowing here. Okay, well, because it's Sunday and I don't want to hold you long, I'm going to get started. First let me introduce myself for those of you who may not know me. I am Dr. Monica of Deep Rooted Health, a practice of transformative health and well-being. Excited to be with you all. I don't do a lot of Facebook Lives, and if that's something that you guys want, then I will actually do more of these. Hey, Michelle, welcome. Come on in. I wanted to come to you all, and hopefully it's not too loud out here. There's a few planes overhead, but I'm an outdoor person, and it's a beautiful day, so I thought, what better way to talk about vitamin D than to get a little sunshine. Okay, so that's why we're out there. Hey, beautiful, how are you? So today's topic that I wanted to come to you all with to welcome in the new year is vitamin D. I get a lot of questions on vitamin D. I actually was on a forum with beautiful Kaya Ayante, and she has an organization called Black Pink, and we were having discussions and talking a bit about vitamin D, but I felt like this was a topic that really we didn't get to really bite into, because there were so many other great things that we were talking about on that day. And so if you all get an opportunity to go back and look at that video, there's a lot of great information on there. But I still get quite a few questions about vitamin D, and in my practice we talk about vitamin D a lot and have been for a while. So it's really good that the news is also now carrying information that supports this for the general public to understand. So that's kind of where the conversation came about, and why we're kind of having this particular discussion today on vitamin D. And I get questions, DMs, and so, well, I said if I'm going to go live, this would probably be a good topic to go live on. So welcome. You guys welcome. Come on in. We're about to get started. For those of you who don't know me, I'm a board-certified family medicine physician. I've been in practice for almost 25 years, and I'm currently living here in Atlanta, and kind of transitioning into some more wellness work in the next few months. So hopefully I'll have more time to spend on doing discussions like this and working in the community on the prevention of health and the healing, and so I'm excited about that. So you guys be ready and stay tuned. At the end of this broadcast today, I'm going to be announcing my website that is available for you all, as well as my beautiful daughter has given me a new brand, and I will be actually launching that at the end. So, hey, Lakita, thank you for coming. Welcome, welcome. So today's topic is vitamin D. And vitamin D is something that is a vitamin, just like the other vitamins that we take or should be taking on a daily basis, or more importantly, getting from our food source. I'm a really big supporter of food being your first medicine. So that being said, vitamin D is one of those deficiencies that we have been treating kind of on the low for a while, and noticed that patients were coming in the office and had vitamin D levels that were low, and then we're only thinking of it as something we need to be worried about for their bone. But the truth of the matter is, upon further in-depth look, we know that vitamin D does a lot of things, so we'll talk about that today. I wrote some notes because I get so many questions. I don't want to miss anybody's question, so I'm going to go a little deep into how vitamin D works a little bit, and then we'll come back out and talk about the benefits of vitamin D. So first and foremost, vitamin D, what is vitamin D? So we have lots of vitamins. Some of them are fat soluble and some of them are water soluble. And really what that means is that if a vitamin is water soluble, you can take it in, and if you don't need any of it because you have too much, then you will actually urinate it out. Vitamin B's are in that way, vitamin C's are in that way, and we mega dose those all the time to get energy or to give us immune support. But what I want people to understand is that all vitamins are not built alike. Vitamin D in particular is what we call a fat-soluble vitamin. A fat-soluble vitamin is a vitamin that can get absorbed into your adipose or your fat cells, and it can hang around. And so we have to manage it and deal with it in a little different way. And when we're deficient in it, also we deal with that in a different way as well, because we have to get those levels up. What's our sources? The one we hear about most commonly is the sun. And that was originally why we were thinking that, maybe the uptake of vitamin D had decreased. Why? Because all of us, we're all inside all the time. Hey, Fonzo, welcome. So we're inside for most of our jobs. We don't get sunlight. And now with COVID, even more so, right? But this was going on before COVID. No direct sunlight anyway. So when you are deficient in the vitamin, you think, well, I just need to be outside more. That will help, but there's also food sources that you can get vitamin D from that are good, and the main food source that we talk about is like a fatty fish. Your fatty fish just being salmon and all the ones that we talk about that are healthy to get the good fats into your diet. So that's a source. You have things like liver, beef liver, and things that we don't necessarily always eat all the time, and so that's another reason why you would see that your vitamin D source could be actually depleted. Now, the other way of getting vitamin D is by supplements, and that's where we're really hitting hard right now, is trying to supplement the diets of our clients and try to get that level up. So supplements can come in different forms. You've seen them in gummies, you see them in chewables and other forms. They're tablets. You can also see them in mushrooms. They do an actual procedure where there's, hey, goes little sister, hey Kiki. I see that they basically, what they do to the mushrooms is they do some ultraviolet exposure to the mushrooms, and that'll be one of the supplements that you can actually purchase and to get your extra vitamin D in. So those are the ways in which the forms in which you see vitamin D coming. The sunlight, we don't actually talk about how that actually works. So the sunlight actually hits our skin and makes a conversion in the skin. It makes a conversion that's actually transmitted through the skin. There are other organs that are involved in the conversion of vitamin D into active vitamin D, and that's going to be your kidney and your liver. So having those organs be healthy is also really important to making sure that our vitamin D levels are where they need to be, and that's how we get the active the activated version of the vitamin D that we really need. Um, when we talk about vitamin D, we say, well, what does it actually do? How does it help us? And if you're over the age of 50, the conversation of vitamin D comes up frequently because we're talking about maybe osteoporosis or bone health. So vitamin D itself actually helps the absorption of calcium, which we all need for many things, not just bone, but it helps the absorption of calcium in our intestines. Hey, big sister Alicia, welcome. Welcome. So to get calcium absorbed better, we need to have the combination of vitamin C and calcium together. You'll see that when you're purchasing it at the store. You'll often see that that will be a combination that you'll see together. It also does a combination and helps the absorption with phosphate. So you have calcium, phosphate, and vitamin D kind of all rolling together. And so you'll see when you're looking at deficiencies, we're looking at all those levels together. Vitamin D, because of its calcium role, also has a role in prevention of what we call tetany, or cramping, muscle cramping. So when you're working out or you're getting a lot of muscle cramping, never thought that maybe it was your vitamin D level that was inhibiting possibly calcium absorption that could be causing this too. So another reason why checking your vitamin D on a regular basis, and when I say regular, at least annually, to see where you are. And we'll talk about what those normal levels are as we get further into the conversation. It also helps, and we hear about this all the time, with bone growth and bone remodeling, and that's what osteoporosis is all about. So what does that mean? When you have a broken bone, or as you get older and your stores of calcium can get depleted, your bones can get more fragile. So having that vitamin D to help absorb calcium helps to strengthen your bones. And osteoporosis is another conversation that we can talk about at another time, and how we help to prevent as well as to treat that with some natural things as well, things that we should be doing on a daily basis for that. The lack of vitamin D can be seen in children. It can be seen in adults. We used to hear about rickets all the time. You don't hear about it so much in our country. Hey Tisa, welcome sis. You don't hear about it so much in our country so much anymore, but it is something that we still need to be really kind of alert and aware of. And osteoporosis, osteomalacia, those are all disorders that people who have low vitamin D levels will find. What people don't think about is cell growth. Vitamin D impacts how our cells grow and move. We have receptors on a lot of our cells that are vitamin D activated or initiated with the use of the vitamin D. And vitamins also, I didn't say in the beginning, they're coenzymes. And I don't want to talk like too sciencey, but I think it's really important that we understand kind of why do we even take vitamins. So coenzymes means something that makes another reaction happen. You need this there to make another reaction happen. So if you eat food and don't have proper vitamin source, you can't get the energy out of the food. And that's how I kind of explain that to people. So having receptors on a cell, like to help with growth, and not having that vitamin there to help that cell do what it's supposed to do, means that we're not working at full steam, and we're not optimizing what we need to be, where we need to be to get an optimal health. So that's important. The thing that you hear now more than ever is the impact of vitamin D on your immune system. And that's, for a lot of people, is the newest, brightest news about vitamin D. The immune response that we are seeing with vitamin D as we replenish it has been remarkable. And we can talk at the end a little bit about how that is impacting us right now with all of our immune systems being attacked, as well as what they're doing as far as using it as a treatment for some of these immune issues that we're having. We talk about glucose, which is sugar, and how we break down sugar, and weight loss, and how we use our food. Hey sis, hey Bridget. We want to always remember that to metabolize, and metabolism is just the breaking down, how we use the energy foods and things that we have. vitamin D impacts that. It has a part to play in that as well. And with children, we have to remember that we're always growing muscle-wise and we're always growing bone-wise. So them having adequate vitamin D sources and support is really important as well. We talk about that with adults a lot, but as a family practitioner, I deal with all ages, and having the right nutrition from the beginning, even in pregnancy, vitamin D is a really important part of that process. So important that we don't forget about pregnant women, and we don't forget about children. The preventative portion, we talk about immune systems, but also cancer prevention. Cancer prevention has been shown to be impacted by vitamin D. It helps to prevent the start of cancer, and it also has been shown to work on the regression, meaning the treatment, the shrinking of tumors. So having a good and more than adequate amount of vitamin D will also be helpful in that. All right, so we've talked about why is it important, and what it does and how it's working. A little bit, like I said, not going to get too sciencey on you. There are two vitamin D types that you hear about a lot, and that's going to be your vitamin D2 and your vitamin D3. And these two are pretty similar, but the difference is kind of where they are metabolized, where they're made. One being more so in the kidney, the other being more so in the liver. Also, kind of how much of it is more easily absorbed, or how much longer does it stay around, is one of the differences that we also see. And we find that vitamin D3 is a little bit more easily used, and it also stays around longer. But vitamin D2 does have its place, and when we talk a little bit later about treatment, I'll tell you why I use one versus the other, and then we'll talk about dosages as well. It's really important that we understand when our body is doing what exactly. So at all ages, your body is able to absorb vitamin D from the gut, from the intestines, from the stomach. Well, I should say specifically intestines. Really and truly, really important. At all ages, vitamin D can be absorbed from the stomach. Only as you get older do we have a difficulty absorbing it from our skin. And there's some other things that I got caveats that help talk about why things change with vitamin D absorption from the outside, the skin. But at all ages, it is important to know that you can take a supplement and get improved vitamin D levels. Okay? Vitamin D, we measure it when you first come into the office. We'll do a serum D25 level, and to see exactly where you are on your vitamin D level. And when we do that, we're able to kind of tell you how low, how normal, or how exceptionally good you are with your vitamin D, which unfortunately I don't see enough of. So your levels are at a direct correlation to how healthy. Hey, Big Sister Joy, welcome, come on in. But your levels are a direct correlation to what type of benefit you're getting from your immune system. What type of benefit you're getting from your immune system. Those levels are where the controversy comes in. And the controversy really is about, what is enough vitamin D, what is too much vitamin D, and how are we sourcing that, and where are we getting it from. So the societies, the medical societies, the journals, there's not a really great agreement on what that is. And I will tell you that most of the time we are under sourcing. We are underestimating how much vitamin D we need. So we talk about recommended daily allowance, RDA. You'll see that on the back of your food boxes. You'll see that on the back of your vitamins. And remember, when that when you see that term really is about the baseline, the minimum that you need to be okay. I don't know about you guys, but I'm never shooting for the baseline. I'm never shooting for the average. I'm never shooting for just enough. And because we normally, when we do that, we're not optimizing. We're not getting everything we can from whatever we're doing. And so the RDA is important because some people, that's all they got. But for those people who really want to push their health to the next level, we want to be past that. So when you're talking about levels that you're ingesting of the vitamin D baseline, we talk about for children that between the ages of 1 and 18, I tell you, chewable vitamins for children. Children aren't really into wanting to take their vitamins, but chewable vitamins in children, you should be getting at least like 400 international units for children, at least. That goes up to 600 units when we're talking about adults. And then when we get to adults over the age of 70 or 50, I guess, 50, I'd say 600. Over the age of 70, then they have to be taking at least 800 units. So 400 units for children. Adults, I would say at least 600, and that would be for pregnant women as well. And for anyone over the age of 70, minimum of probably 800. Now I'm talking about minimums. To get to the levels, and we'll talk about the levels next, that we really need to optimize our health, we're really talking about levels that are much higher than this that you should be taking. And those supplements are available out there for you. So I have a patient come in and I do a blood test on them and find that their blood level of vitamin D is less than 30, which is our cutoff. 30 is our cutoff. My first thought is, depending on how far down they are from 30, is I want to do a replacement with vitamin D2. Vitamin D2 comes in very large doses of 50,000 international units. And what I'll do is I will do a 50,000 unit once, maybe twice a week for about 2 months, 8 weeks total. So 50,000 units, and doing that once, for most people it's just once a week for 8 weeks, depending how low it is. Maybe it's a 14, a 9. I've seen it as low as a 9. I'll do twice a week for 8 weeks, and then I'll retest those levels. If I retest those levels and we still are not close enough to 30, then I may go ahead and do another 8-week round of the vitamin D2. At this point, we do another 2 months, and then I test your blood work again and to see if we've gotten closer to 30. Now, if I'm in the high 20s, I, at that point, can stop doing the mega dose and then go to a regular, but a higher dose, I think, than what people are used to buying in the store, which is, like I said, 600, 800. I would go at that point and suggest to you guys probably looking for like a 5,000 at least, and maybe even 10,000 depending on your age or some other factors that I'll talk about, what would make you more difficult for you to be an absorber of vitamin D. So recapping on that, go to your doctor, go to your provider, get your blood work done, and see what your vitamin D25 level is. At that point, if it's less than 30, you know that you are deficient and you're going to need an extra boost of vitamin D, and then be taking a daily supplement. This is outside of any diagnosis of any medical disorder of osteoporosis, osteomalacia, osteopenia. That's just baseline for all of us, should be looking at that. If you talk about sun exposure as another treatment, I always tell patients that you need to be outside. And there's so much talk about sunblock and sun cancer. An absolute truth, absolute phenomenon that happens. Even African Americans, we do have sun cancer that excuse me, skin cancer that affects us. So I am not telling you to throw away any kind of sunblock and go out and never protect yourself. But I will say that between 5 and 30 minutes of sunlight a day would be absolutely the way that you would also help yourself to get vitamin D to your body. And it's necessary. It's good for you. So we don't want to leave that out as a way of taking this in. Supplements are absolutely very important, but getting outside, getting some sunshine is as important as well. You probably won't get enough just because of the way our lives are. Even sunlight, the UV light that comes through the window actually doesn't allow the sun to be absorbed into your skin at the levels that you would need to actually get really good absorption for the conversion of the vitamin D. So you're still going to need a supplement, but I would never take away the fact that we need to be outdoors as much as we can, with our face exposed, our hands, our legs exposed, and because those are the areas that will actually give us a lot of surface area to make this vitamin D conversion. Hey, Sister Sharon, come on in. Good to see you. Glad you came. One of the interesting things that I think that is for those of us who use it, because I have patients who do go to tanning beds and use that. There is conversion that happens with tanning beds. So I wouldn't say that would be my number one choice for you, but know that when you are tanning in a tanning bed, there is some conversion to vitamin D, from my understanding as well. So that's good news. Let's see, what else did I want to cover with you guys today? I talked to you about the vitamin D3 and the vitamin D2 and the evidence that the D3 actually stays around longer and causes higher levels of vitamin D, and that's one of the reasons why usually from a maintenance standpoint, D3 is what you'll find at the supermarket, at the grocery store, at your vitamin shop. So know that is why we're using the D3 as the continued. I use the D2 to get that boost, and it's so important. Just talking about the deficiency as from a numbers standpoint, men and women both have been shown, in 92% in men and 97% in women showed that they were deficiency, and even 1-year-olds were deficient in vitamin D. So that's a remarkable thing to think that we're doing such a poor job with our nutrition in our country that to have that high levels. But I see it every day. Most patients that come in have some sort of deficiency in vitamin D unless they're actively working on it. And that is as simple as taking these supplements that we're talking about. If you do it by demographics, if you do it by race, African American and brown skin, people are actually going to have a higher level of deficiency, or a higher percentage of deficiency. Not saying our deficiency numbers are higher. I'm talking about as a group of people, we have a higher incidence of vitamin D deficiency. We are followed closely by, I think we're 17%, and well, not even, I shouldn't even say closely, because 7.6% are Asians and 5.9% is Hispanic. So, and Caucasians only have 2.1%. But even at 2.1%, you'd be surprised. I see still quite a few of that in my patients that come in. But that's a huge disparity. And we'll talk about a little bit about why that is. Obviously, nutrition can be a major part in that. Also, melanin is a situation where it does not, in this case, help and inhibit the absorption of the sun rays that would actually make this conversion. So we celebrate our melanin, but know that in this case we do have to be careful, because it can cause us to have lower levels of vitamin D. And so it's really important that our community check and make sure our vitamin D levels are where they need to be. The other person that would be at risk of not having enough vitamin D would be someone who had some type of malabsorption syndrome, something going on in their gut where they could not actually absorb the vitamin D. And so, if anyone who has lack of lactose intolerance or who are not taking in milk products which are fortified with vitamin D, meaning that it's put into the milk, they would not be taking in vitamin D as often as somebody who was drinking milk on a regular basis. So they need to be careful about their vitamin D levels. If you have an issue where you're not taking in a substance, cheeses, milk, even foods that are vitamin D rich, and so therefore you would have deficiency as well. Breastfed infants, which I'm a huge advocate for breastfeeding, we need to be very, very aware that you may need to supplement your breastfeeding with vitamin D for yourself so that your baby can get the vitamin D. I believe breastfeeding is essential, and if you are capable or if you are in a position to breastfeed, by all means do so. There are so many more benefits than not. And know that formula fed babies are just getting their breast formula fortified with the vitamin D. So it's not as though formula is better. It's just, don't think that because you're breastfeeding that you've necessarily gotten everything you need in your breast milk, unless you're taking it in as a supplement for your baby. So you are what you eat, and so is your baby. So make sure that you're doing that as well. Older adults, as we talked about a little while ago, older adults do see a decrease in the absorption through the skin for the conversion for vitamin D. So that's something that does change as we get older. As I mentioned, they are also more likely to spend time indoors, just like those of us who are working a lot and who have offices inside. Our older adults are going to definitely be inside sometimes more often, and sometimes often don't have, because of whether it's on a fixed income or just the quality of the foods that they're taking in, may not be getting those foods that are fortified in vitamin D. So important to check on our elders to make sure that they are getting good food sources and supplements such as vitamin D, especially in the era right now that we have with COVID. If you have parents that don't live near you, or you have parents that live near you, making sure that their vitamin D supplements are up to par is important too. Hey Benita, nice to see you. Nice to see you. There are also some issues with patients who have previously undergone a bypass, gastric bypass, because the area in the intestines where there may have been surgeries done or excision of intestines may be the area where the vitamin D needs to be absorbed. And so if you don't have that area, it's going to be harder for you to get the supplementation levels that others may, and they may be taking the same amount of vitamin D that you are. So checking your vitamin D level as someone who has had gastric bypass surgery is also very, very important. Speaking of weight and how does that have an impact on your vitamin D level, I don't spend a lot of time on BMI because BMI can be skewed in a lot of cases. But for someone who has excess fat or adipose or on them, know that, and we talk about a BMI of an obese person being greater than 30, and that's different than a muscular person. But if you have extra fat stores, know that even though you're taking in the vitamin D supplement, you may need more. Why? Because the vitamin D can actually get absorbed or stay in your adipose tissues and not get to the bloodstream and get to where it needs to be active. So it means that you need to be checking your levels. And you go to the doctor, you go to your provider, and you say, well, I'm taking vitamin D. I don't understand why it's not working. You may need higher levels so that we can actually kind of make sure that it gets from the actual tissue that it's sitting in into the bloodstream and be productive for you. So that's important. Let's see. I think we've covered almost everything. If you're vegetarian, also be vegetarian or vegan, that can be an area where you need to make sure that you're taking your supplementation on vitamin D. So that is another thing, and all these things I'm very supportive of. These are lifestyles I'm very, very supportive of, It's just we've got to be educated about how do we do it in a smart way, and how do we give ourselves the things that we need when we're trying to take good care of ourselves and just don't have the information. So that's hopefully what we're bringing today. People with Crohn's disease, cystic fibrosis, issues with those are issues where you have some malabsorption because either your intestines are inflamed, or if with cystic fibrosis you have an issue with blockage because of extra mucus production. Those are areas where you need to also be taking extra careful look at your vitamin D level and making sure that you're taking enough and that you are getting enough. So I hope that I've mentioned yet, and if I haven't, what is the optimal? What is the optimal level? We talked about what the minimum level was, and the minimum level we said is 30. But when I talk to patients, what I'm looking for is an optimal level, and an optimal level would be at least 70. 70 is one of the magic numbers. I'm looking for 70, 75, those numbers. Is it possible to have too much vitamin D? Absolutely. Possible. Very hard to get there. I have yet to see patients whose levels are where we consider elevated, maybe above 125. But if you can get your level in the 70s, 80s, you're then at the place where you are actually seeing some immune protection. You're seeing extra anti-cancer protection. You're seeing those things that we talked about earlier. We're seeing the ability to actually say I'm actually protecting myself and not just hitting baseline. So that's the level. That's the magic number. 70, around 70 anyway. That's the magic number. Let's see. Did we touch on everything? Having too much. You can't get too much sunlight. You can't get vitamin D toxicity from too much sunlight. Like I said, it takes quite a bit of sun exposure for that to happen. So know that is not going to happen. Try to get out there as much as you can. Get into the sunlight as much as you can. Let's see. Oh, one of the things that I thought was really important to bring up too is what things can block your vitamin D absorption. Sometimes our medications can get in the way of how much vitamin D absorption we're getting. When I say this, things like statins, our cholesterol medications, when things are competing for the same markers in our body, then somebody wins. Somebody's got to win. And so you may see that there's a decrease in your vitamin D level or in your statin level if the vitamin D supplementation you're taking is competing with that. So be aware of that. Have that conversation with your doctor. Let your doctor always know that you are taking supplements. So a lot of times my patients will come in and they just give me the list that they got from the last doctor they had, and they don't think that it's important to tell me about supplements. I'm passionate about patients being able to use supplements and their food first. But if they're using supplements, I want to know about it. I want to have a conversation. I want to know what you're using and support it. I have a lot of patients who I support completely on supplements only and not on prescription medications. For those of you all who have been my patients in the past or who've been rocking with me for years, know that my goal is to keep patients off of medicines, to get patients off of medicine, to get to their best health, to get back to baseline transformation of their health, baseline to where medicine wasn't as needed. But if we need to use medicines, I know how to do that. But when you're talking about taking supplements such as statins or diet medications like Orlistat, that also competes and blocks fat absorption. What we talked about in the beginning, vitamin D, it depends on fat absorption. And so when you're taking certain medications, you're going to find that you may not be getting the vitamin D response that you thought you should, and it may be because of the medication that you are actually taking. So talk that over with your provider, and so that you all can work together, making sure that you always tell them everything that you're taking, any supplements that you're taking, along with the prescriptions they may be writing. Let's see. Oh, steroids. That's another one. Steroid ingestion of steroids, which we sometimes have to take if you have an immune issue, an autoimmune issue, and you're trying to get that under control. Some people are on steroids, and that can work against your absorption of vitamin D. and because that also reduces the calcium absorption as well. What else? Diuretics. This is something that's very common. Thiazide diuretics. Anybody out there on HCTZ or hydrochlorothiazide? That is something else that you can see that there may be a challenge with your calcium levels, and which, like I said, was related to your vitamin D. So if you're on a thiazide, hydrochlorothiazide, or HCTZ, you need to, and you're having trouble getting your vitamin D levels up, you can consider that may be one of the cause, and talk to your provider about other options that you may have. Those are the major points. I don't want to give you too much. I know that that was a lot of information. If you guys have questions, I'll try to scroll through and see if I missed any questions. I posted an article on my Facebook page about COVID and vitamin D, and how there's a hospital in Spain that noted that a lot of their COVID patients were found to have vitamin D deficiencies. And this was really important because this talks to us about what we need to do from a preventive side. There are also the Mayo Clinic and other larger facilities are now acknowledging that this is the case, and that they're even using vitamin D as part of treatment plans. And I think it's important that we use our own knowledge, so before we get to the place where we need to be in a hospital. I want you guys to take the information that we learned today and to go do some reading, but most importantly, go invest in a good quality vitamin D supplementation, and take it daily. Nothing is good if it's just sitting in your cabinet. Take it daily. Increase your vitamin D in your daily your nutrition. I want you guys eating more fatty fish and getting your vitamin D in that way. I want you guys getting outside and getting some sunlight. That's very, very important. If you guys have any other questions, please don't hesitate to reach out to me. So how this works with my Facebook page, and I'm on Instagram now as well. I want you guys to, if you have a question for me, please post it. And if you can post it in when they have just the subject at the top with the pretty backgrounds, if you post it up there as a singular question and not below as a response to someone else's question, I'll be sure to see it. I try to check those pretty regularly. Hopefully in the next coming months, as I roll out some special plans for you guys, that I'll be freeing myself up more to be available on different platforms. I'll be able to get to things a little quicker, but please feel free to ask me any questions that you may have. I'm going to scroll and make sure I haven't missed anything. Thank you guys so much for coming, everybody. I really appreciate it. If you have any questions, please let me know, and I will do my best to answer them. It's so good to see all these faces, new faces, old faces. I appreciate you guys. Thank you for coming out and supporting my talk today. You guys know I don't get on Facebook Live often. My fear is that there's so many people out here giving great information. I only want to come to you guys when it's something that is really useful. So Nina asked, I'm prone to kidney stones. Is it okay for me to take vitamin D? And I would say yes, it is. Kidney stones is a big subject in the sense that they're all different kinds of kidney stones. So depending on whether or not your stones are calcium derived stones, you would want to know what kind of stones you have, and that'll kind of help guide what you need to stay away from. But you may not need extra calcium. This helps the calcium be absorbed, but as I said, there's so many other benefits to vitamin D. I wouldn't, if you have calcium as the component in your kidney stone, Nina, then obviously taking calcium supplements may not be for you, but taking vitamin D would be helpful still, and then you'd get the natural absorption from just your regular food. So I do still think that you would benefit from vitamin D. oxalate. So yeah, so your vitamin D supplement, and at a certain point, if you need to take the calcium and the vitamin D together, I think you'd still be fine to do them together. Great question. Anybody else have any questions before we go? All right. Well, thank you guys once again. As I said today, I'm going to be launching my new logo, and my website will be out as well. It's www. It's deeprootedhealth.online. So it's a little different. It's Deep Rooted Health. That's DEEPROOTED Health. HEALTH, and that's all one word, .online. So you guys go check me out there. The website is growing. I'm affiliated with a few different companies that I would love to introduce you all to, and you'll have some links on there to show some of the products that I use on a daily basis. And can be helpful for you guys. I like to use products that don't have a lot of additives to them, and so I'm affiliated with a few of organizations that I'm going to come back to you live and give you some more information, to give you a little tidbit on what I'll be doing after February as far as my work in the community. And so stay tuned for another live about that. What's the correlation between COVID and low vitamin D? Yeah, so the correlation between COVID and the low vitamin D levels is what the study that was done in the hospital in Spain. And so what they found was that their patients who had COVID also had low vitamin D levels. And so the COVID tends to cause inflammation. And as we talked about before, one of the things that vitamin D does is it helps to reduce inflammation. So low vitamin D levels, high inflammation, what we want to do is try to get those vitamin D levels high enough so that you don't have so much inflammation, which we know when we talk about inflammation, that caused a lot of the issues with the vasculitis. It's been very difficult for COVID patients, and the clotting and all the things that go on with that. So that is the helpful place where vitamin D is really showing impact. So yes, there is a definite correlation between low vitamin D levels and how well you fare in fighting off COVID, and also in treating the COVID as well. All right. Well, thank you guys. Have an amazing Sunday, and I will see you soon. And be blessed, be transformed, have a deep-rooted day. Bye.